we will show you how in our technique with the washing it will be for the 14 days. Now we have like this here, for example, this is our head. Okay, sometimes we have the crown area of the operation, sometimes we have the front, sometimes we have the both. But for your technique for your operation was in the front area. So how we will clean the with the washing? First, we have in our bag here 2 lotion and 1 foam. The beginning it will be with the lotion that we have it here. That will be with the put it in the operation area. Okay, for the first wash with this lotion we will leave it in our head for 35 minutes. After that, from the day number 2 until the day number 14, we will leave it from 20 minutes to 15 minutes. Okay, after that how we will put it in the operation. After we put it like this, we need to use the tabbing technique. Okay, why? Because to avoid damaging for the graft and to be lightly and gently for the head. Okay, for example, like this it will be for all the implantation area. After that, just a little bit in the donor area we can put, and we leave it for 35 minutes for the first wash. After that, we have the spray. For example, this is the head. Okay, we will put after that to clean this wash here, the lotion, okay, with the spray that we have it with the normal water inside. Now when we start, for example, this is the head and this is the operation, not too much close, not too much away, in the middle range like this, and we will clean all the lotion area. Okay, after we finishing cleaning the lotion, we start with the foam here. With the foam that we will use it for all the head. Okay, we will put it for all around the head, but any area not in the implantation area we can do a little bit strong like this. That will be okay, but in the implantation area again with the tabbing technique that will be okay. After that, directly we will start with cleaning the foam with the shower that we have it. We need to make it a lightly or gently. After that, in our head away a little bit. After that, all the foam it will go. Now when we want to make it dry, we need to use something not included the cotton, okay, because that will be risk, so maybe it will come stick with the graft that we have. So anything that not include the cotton, we can use it with that. Okay, now with this technique we will start to use it from tomorrow until the day number 9. Okay, the day number 10 we will have stop. We will not have anything. Okay, we will not have any wash, we will have nothing, just give a break. After that we will start again from the day number 11, but with the removing the crust. Okay, how we removing the crust? The same technique, but when we put the lotion, not direct with the spray, no, with our finger like this, too much lightly, too much gently like this, to removing the crust. Okay, if it doesn't out with this in the 11th day, then the day after. If it doesn't do, the day after. Okay, like this. Don't reinforce your graft, because maybe that will damaging the graft that we have. So with this technique, after that, spray, foam, shower, and that's it. This is the technique that you needed to use it from the day number 11 until the day number 14, and with the normal wash from the day number 1 until the day number 9. And this is about the wash, and that's what you need to do with the 14 days. Now also the exercise is not allowed to you. Anything that you can make you sweat is not allowed for sure. The cigarette, alcohol is not allowed for 2 weeks. The shaving is not allowed until 1 month, and the exercise, the sport also after 1 month you can do it. You should to be careful to touch anything for your hair, because like we told you before, the graft is too much sensitive, so anything will touch the graft, maybe that we will lose it.
What's in that set?
Now with our set here, this is the big set that we have it here. That set here,
yes, that's what I bought.
Include the derma roller with the 5 ampoules, with 3 shampoo, the bottle of the shampoo, with the 3 bottle of the spray, with 3 bottle of the multivitamin. Now that will be enough for you for 3 months. Okay, now we have the multivitamin here. The multivitamin, each bottle that includes 60 pills. Okay, that you need to take it, 1 in the morning, 1 in the night. Okay, after that, when you use it, after you finish the multivitamin, we have the spray and we have the shampoo. Now our products here that include the biotin and creatine, this is the most effective things for the hair loss. Okay, because there is no rate when you use that, not like the another medication. This is without side effect. For that we try to use it for our medications here. Now we have the shampoo, for example. Also all this medication is making the hair more strong and is stop the hair loss. Now, for sure, the hair loss will not stop for 100% because, like in the end, it's genetic things. But that will make minimizing for the hair loss that we have it. For example, if we have 50% of hair loss, then we will make it until 85, until 95. We use this and another medication that will be very perfect, and that will make a different result for you. Okay, and this is, we have the shampoo like any shampoo that we have it. But what is the difference here? We are having inside the multivitamin and the green tea and the stem cells that we have. Okay, so that help the hair to make it more strong, to feeding the hair also from the beginning. And also we have the spray like, you know, for example, my hair, I take a shower, I go out, it's coming dry. One of the causes that is causing the hair loss, it's the dryness. So we need to use the spray after that. And every time we can keep it for 7 hours. Okay, every time you see your hair is coming dry, you can put for your hair. Okay, after that we coming here with the derma roller. The derma roller, it's working like the PRP. This ampoule, it's working because in German, in any country, it's a little bit expensive, so not all the patients they can use it. So they can use the derma roller with the physiotherapy that we have it here. Okay, that we can use it with the derma roller. Now with the first, we need to put the medication with this ampoule that we have it. Okay, we can use it once in the week, or we can use it one ampoule for 15 days. Every 15 days you can use one ampoule. It depends on you. Okay, now with this medication that we need to put it for all the head, okay, and the skin here. After that we will start with the derma roller from the beginning until the back, okay, from all around the head. After that, with this medication, with the hole that we already opened, that the medication is coming inside, so that it's feeding the graft from the beginning. What that will help us, that will help the graft to grow too much good, too much strong, no hair loss that will be, and a lot of things. This is the best thing that we can have it here, because that it's working like the PRP. Like, you know, everyone, the PRP, it's working like it's plasma from the body. Here it's working the same.
Wow.
And give it the effect, and it's very good.
So just to clarify, you put the liquid
Yeah.
on first,
Yes.
and then the derma roller.
Yeah, with the derma roller, because the derma roller, like you see it here, there is a small needles that will
Right.
not feel it.
Okay.
This is open a hole, a small hole that in our head.
Ah.
With this medication, it's coming inside, so that it's
Gotcha.
feeding the graft from the beginning.
Okay.
So what is the feeding the graft? That's help with the processing, the healing processing, the growth processing, a lot of things.
Gotcha. Brilliant.
And this is our head here that you already have. So with that,
Yeah.
$3.
That was
so you
my
for 9 months that you have it.
Yeah, that was my Christmas present for myself.
Yeah. And also for you, happy birthday for tomorrow.
Oh yeah, and happy birthday as well.
Yes.
Yes, thank you. Yeah.
Yeah, welcome, sir. And
Thank-
that's it about the wash and our products here. And also, and then just I need to tell you about something that's named the gel aloe vera. Now we have something that's named gel aloe vera that we need to put it in the donor area. Okay, what is the benefit from the aloe vera? Sometimes when we have, now we're removing the bandage, we put the medication, our medication here, but it's coming dry in the donor area. Why we don't want to make the donor area dry? Because when it's coming dry, that will circulate here, so that when we're doing like this, what will happen? That will damaging the donor area too.
Yeah.
To prevent that, we need to use the aloe vera gel. That will be amazing, and that will make the healing, the homogeneous, and a lot of things more better for the head. For that, we need to use the aloe vera. That will be much better for you, for sure. That only one packet you need it.
Okay.
Okay,
Fantastic.
and that's it.
Thank you.
Welcome,
Brilliant.
sir.
Thank you very much.
Welcome, sir.
Hope you found that insightful, because I won't be able to remember any of the instructions, so I can watch this video back and make sure I'm doing all right. Thank you.
Welcome, sir.